And welcome back to Notre Dame Day. I'm Terry McFadden, and joining us now on the Notre Dame set is Heidi Beidinger, an assistant professor at Notre Dame's Eck Institute for Global Health. Now, prior to Notre Dame, Professor Beidinger served for 13 years at the Centers for Disease Control in various leadership roles. And she's here today with us to talk about how she's helping to improve the health of the South Bend community. And Professor, thanks for joining us. So you spent a long time at the Centers for Disease Control, and people are probably curious, what did you do there?
That's right. Thanks for having me.
Yeah.
So what did I do at the Centers for Disease Control? First of all, I'd like to say that I absolutely loved my work at the time when I was working for CDC. I was in the STD HIV prevention program, and so focused on sexually transmitted diseases and the prevention and transmission of HIV. And the things that I really focused on were implementing public health programs, doing surveillance, and spearheading new programming at Cook County Jail and Cook County Hospital.
Quite a challenge, I would imagine.
Yes, it was.
And aside from the CDC, 10 years as an education consultant for grades K through 12, you also hold a PhD in educational leadership. How has your professional and educational background shaped what you do here at Notre Dame?
Yes, well, I have a very diverse background, as you just described, and my position allows me to operate at the intersection of my different degrees and my experience, which is really kind of unusual. So my years in public health obviously speak to the work that I do with the Master of Science in Global Health program. There's a tremendous amount of overlap in what it is that we do, solving real-world problems, right? My work in education then has allowed me to come to campus with all of this expertise in teaching, developing curriculum, developing student engagement. So not only can I be effective in the classroom, but I'm also effective with the research that I do in global health.
And let's talk about this project that I know is near and dear to your heart. Right here in our local community, you're addressing a very specific health hazard that we've all become familiar with here in South Bend. Tell us about that.
So right now I am very laser focused on lead poisoning. First, let me share with you and the audience is that there is no safe level of lead. Any level can be toxic to children. So in working in this arena, what we're focused on right now is developing a home lead test kit so that homeowners and parents can actually test their home and assess their home for lead risks. Ultimately, what we want to do is we want to change the paradigm surrounding lead. Currently, what we do is we use children's bodies to find lead in our environment. So a child will test positive for lead, and then that's when the healthcare industry and a health department and social services takes action. We want to change that. We no longer want to use children's bodies as divining rods. We want homeowners and parents to be able to find the lead risks in their home before their child becomes poisoned.
It's almost tragic that you have to use the child to find out where the lead problem is. How successful have you been in implementing this new method of tracking lead?
Right. So last summer we actually did some pilot work on this, and we're very, very successful, and we learned a tremendous amount. I would say that one major finding is that what we were hearing from homeowners was this sense of desperation and hopelessness. I live in a home that's filled with lead. I don't know what to do. I don't have the resources to take care of my home. And what we found out last summer is the entire home is not coated in lead. There are hot spots within people's homes that have a lot of lead. And what we were able to do is we were able to point parents to those places so that they could take action. Rather than being overwhelmed with this idea that my whole home is a risk, we were able to point them to where they could focus their attention to.
This sounds like a model for something nationwide. Is that your next goal?
That's the next goal. So this summer we are piloting with 50 homes. We have 2 research teams. I'll be in the field with those research teams. And then we're planning on scaling this up. We have a collaborator down at IUPUI. We're going to go statewide first. And then ultimately we want to be able to take this nationwide.
Heidi Beidinger-Burnett from Notre Dame here. Who knows? Maybe someday the next head of the CDC's?
Wouldn't that be something?
That'd be great. Well, listen, we appreciate you coming in and sharing what you do and how you impact these students here at Notre Dame and this great fight that you are leading against lead and lead poisoning that hopefully will spread beyond this campus
That's right.
and this community.
That's the intention. Thanks, Terry.
Heidi, thank you very much.